Okay, next, we're very pleased to have Dr. Alejandra Cantoral. She's a nutritionist who obtained a PhD in epidemiology from the National Institute of Public Health in Mexico. She's a professor at the Iberoamericana University in Mexico City. She's conducted research collaborating with the National Institute of Public Health and international institutions in birth cohort studies since 2009, and in research lines focused on environmental exposures through food and chronic diseases. She's co-authored more than 130 articles published in high-impact national and international journals, and coordinates several projects, research projects, using a community-based approach. Thank you for joining us today, Dr. Cantoral. It's interesting to see your students walking back and forth behind you, clearly on campus. So let's start with, so you're the lead author of the paper, Lead Levels in the Most Consumed Mexican Foods, a first monitoring effort. Can you tell us about the findings of your research?
Good afternoon to everybody, and I'm happy to be here, and thanks for inviting me. And I'm also so happy to be to have my intervention after Jacqueline, because what I'm going to present in this first question is inconsistent with the information presented by Jacqueline. And I'm going to share my screen. Okay, can you see now my screen?
Yes.
Yes. Okay, that's a full screen.
If you want to click it on presenter mode, then we'll just see. Yep, perfect.
Yeah, perfect. Thank you so much. So as Jacqueline mentioned already, so lead exposure, a common source of lead exposure is contaminated food during the food supply chain. And I want to quote that there's no blood lead level that can be considered risk-free. So this is a toxic metal, and even at low concentrations, it can affect the function of every human organ or system, especially for this vulnerable population as pregnant women and infants or small kids. So one key area in public health nutrition is food safety, but also food regulations. And we all know that in more than 30 countries have conducted the total diet studies. And total diet studies are one of the most cost-effective assessments and tools to have a picture of this dietary exposure at national level to toxic elements. And in Mexico, we don't have a total diet study. But additionally, international agencies as FAO have established standards for maximum limits for lead and other toxins in order to promote food production safety. So 4 years ago, with my colleagues from different institutions, we started this first effort. As I mentioned, we don't have in Mexico a total diet study. We have isolated studies of the amount of lead in some foods that are produced in Mexico, but that's all until now. And 4 years ago, we decided to have the information of our National Nutrition Survey, and we selected the top 100 foods consumed by Mexican population. And then we bought these foods in the markets and principal markets and supermarkets in Mexico City, and we analyzed these foods in the laboratory using spectrophotometry. So as you can see in my slide, so from these more than 100 items that we bought, we detected lead in 18% of the products, but especially as you can see here, 4 items exceed the maximum limits according to FAO. And these foods are commonly consumed by infants because they include infant formula based on soy milk, rice cereals, pre-cooked rice, and whole wheat bread. So we were very concerned about our results, and our next step in my group is to run a baby food monitoring program in Mexico once again, using or taking into account the most consumed baby foods by the Mexican population.
Okay. So did you want to go through the rest of those slides, or we'll just keep doing the kind of Q&A? Okay. So a question. So tell us about your latest research on lead poisoning in pregnant women and women of reproductive age in Mexico.
Okay. So sorry, I'm going to share again my screen, and because this is another topic, just to talk about this research that we have been conducted in different communities, I want to start making like a context in the Mexican population. So lead exposure, it persists in the general population in Mexico, mainly to the presence of lead in food and beverages cooked, served, or stored in low-temperature lead-glazed ceramics, which is part of our culture and our traditions. So lead oxide is used to melt glazes at low temperature, as we can see in the picture, in traditional ovens. And this is a technique that releases lead to food, particularly to acid food, when this food is cooked or served or stored in these ceramics. But I have to say that going back in time, clay pottery is a Mexican tradition and a way of life, because between 10 to 50,000 families produce ceramics in Mexico. So it's one of the oldest craft industries in the country, and with a history dating back to the pre-Hispanic era. So in the 16th century, after the Spanish arrived to Mexico, most pottery pieces began to be glazed with lead oxide. And since then, we have been exposed to lead. And for example, the first medical report of lead intoxication in children date back to the 19th century. So in summary, for centuries, lead-glazed ceramics have been the main source of lead exposure in the general population, but these ceramics also represent occupational exposure for women working in the pottery producing industry. So 10 years ago, with Pure Earth Mexico and Netsi Peralta's team, we went to Morelos State and we evaluated 60 pottery workshops producing mainly lead-glazed ceramics. So as you can see in the pictures, the workshops are commonly within the central main patio of the houses, which means that all family members, children, women, men, are exposed to this lead oxide. And also, as you can see in this picture, workers don't use any protection when applying lead oxide. So in this first study that we conducted 10 years ago, we evaluated blood lead levels in this pottery population. And we observed that 88% of women had blood lead levels above 5 micrograms per deciliter, which is our reference value for the Mexican normativity. But in this study, we also documented that training on using lead-free glaze in pottery production significantly reduced blood lead levels. However, these efforts to incentivize potters to adopt the lead-free method should be expanded to the thousands of families in this pottery production industry. Then, this is a second study that is a collaboration of various institutions. And we started this study, I have to say that we started this study 6 months ago. So I'm going just to present the preliminary results. And in this case, we are evaluating pregnant women with the support of the health center of a potter population in the state of Puebla. And I have to mention that the state of Puebla is the state of Mexico with the highest children's lead intoxication. About 40% of children between 1 to 4 years present high lead levels in their blood. So the main goal of this study is to evaluate pregnant women and associate platelet levels with hypertensive disorders during pregnancy and other outcomes of the liver. So this is the preliminary results, as I mentioned, and you can see here in our graph that all pregnant women evaluated until now are above 5 micrograms per deciliter, which again is the Mexican reference value. And additionally, we are assessing other socioeconomic aspects of these women. And for example, I can mention that many of these women did not receive a salary for producing ceramics. It's just an activity they made to help the husband or their family in these workshops. And it is dramatically when you see the results because, as you can see once again in the graph, 40% of these women had bloodlet levels between 25 to 44. So this is very important for us, and that is why we are working very, very tight with the health clinic of the community, because we want to solve this exposure in these pregnant women. And finally, in addition to occupational exposed populations, I want to present some results of a community evaluation that we started 3 years ago. We look for lead levels in women of reproductive age in Mexico City's low socioeconomic neighborhood. So in this case, women are not exposed to lead through the occupation. However, 21% almost of the women evaluated had blood lead levels above 5. And through a questionnaire, we detected the primary sources of lead exposure, and the main exposures are the current use of lead-glazed ceramics again, living near a busy street or a highway, and living in a newly remodeled house, which is related to construction materials and old paints. So to finalize these questions, I want to mention that working with women in different settings requires a deep understanding of the magnitude of the exposure, but also to know the context of these women and these communities in order to provide some solutions.
Thank you, Dr. Cantoral. Now, the next question, more of a nutrition focus. So how can diet both cause and be a source of lead exposure or reduce the impacts of lead exposure? And if you can talk to how nutrition can help mitigate the impact of lead exposure, and what does the research tell us about how nutrients and calcium intake can reduce lead absorption?
Well, that's a great question, and Jacqueline already mentioned some things. So mainly food is a source of nutrients and key nutrients, but if the food is contaminated with lead, also is a source of lead or other heavy metals, right? So the presence of lead in food can vary according to so many factors like soil, water, atmospheric emissions, animal feeding regimens, packaging, transportation, storage, cooking methods that we saw. So food can be contaminated in the food supply chain. But the important thing is that once lead is consumed through these contaminated foods, adults can absorb around 10% of the amount ingested, but children can absorb 40% of the amount ingested. So the quality of the diet is quite important because absorption of lead is higher when diets are low in key nutrients like calcium, iron, and zinc. So in the studies that I previously mentioned, around 40% of these women evaluated reported having food insecurity at home. And the intake of these key nutrients was very low. They only cover half of the recommendation, of the daily recommendation for calcium, iron, zinc, vitamin C, etc. So it is as a consequence, maybe they are absorbing much more lead than the rest of the population. Now, the good news is that also previous studies done worldwide, but also in Mexico, have shown that a diet rich in food sources of calcium or calcium supplementation even can decrease the amount of lead that it's absorbed in the intestinal tract, and also can reduce the amount of lead that is released from bones into the blood, something that happens during pregnancy. So part of our work in these communities has been producing flyers with informations to the health clinics, made trainings to the health personnel in the clinics, going to the participants' houses to detect the sources of exposure, but also going to the community and see the foods available in the community, right? And with this assessing of the community and the houses, we produce some recipe books that use the available foods in the community with combinations of foods high in calcium or iron. So the good news is that, yes, we can do something with diet in order to inhibit lead absorption. The bad news is that some women are in vulnerable situations with food insecurity, and they have low quality diets, and maybe they are absorbing much more lead, not only them, but also their children.
Thank you, Dr. Cantoral. I would love to get a copy of that recipe book.
Yes, I will send to you.
Like to distribute this, see if we can distribute that.
The thing is that it's in Spanish. So.
Yes, that's okay. Yes, no need to translate. We'll take it. And we look forward to the publication of this, the preliminary data that you shared. So thanks.